Why couldn't they make it crazy shirt November? Funky tie November?
I know.
Why'd they make it something that sticks to my face and itches November?
It looks good on you though.
Does it?
It's good.
I don't think it does.
It's good. Hi, welcome to another episode of Talking with Docs. I'm Dr. Brad Winning.
And I'm Dr. Paul Zalzal.
Today?
Yeah, we're gonna make a little distinction for you.
Okay.
Everyone has heard of knee replacement.
Yes.
However, some people may or may not have heard of a partial knee replacement.
Right.
Also known as a unicondylar knee replacement.
Right. Like when your surgeon gets like too tired to finish.
And you only got a partial?
I got
Sorry,
a partial.
gotta go to the washroom, I'm out.
Yep.
Let's just finish now.
Inflation, can't afford the whole thing.
Hospital cutbacks, you only got a partial, you
Got a
didn't get a
partial.
total. That is not true.
Not
Those
true.
are just jokes.
Not true.
Partial knee replacement is an implant designed to replace only part of the knee.
Right, so we've talked in other videos that there are three compartments of the knee. So the medial compartment or the inner compartment.
The one that's facing the other knee,
Yeah. The outer compartment or the one that's on the outside.
the one that's facing away from the other knee,
And then your patella femoral compartment where your kneecap glides against the end of your thigh bone.
the front of the knee.
Right.
3 compartments, and nowadays you can replace all or just individually one or the other.
Right. So we talk about a total knee replacement. Usually we're talking about the femur and the tibia, or the thigh bone and the shin bone.
Right, and that's the medial side and the lateral side.
Yes.
Ironically, when we say a total knee replacement, half the time the patella femoral joint isn't replaced.
Right, a little bit of dealer's choice there.
Yeah, so even a total knee replacement isn't always a total knee replacement.
Right. Okay, so
We have talked about this before too. A total knee replacement doesn't mean you're replacing everything that makes up the knee.
No.
All the ligaments, all the muscles, all the nerves, all the soft tissues. That is not true. You're not a RoboCop. We don't just make a cut at the distal femur, a cut at the proximal tibia, and put in a whole new robotic knee. Not the case.
Right.
We're just talking about resurfacing the ends of the bone where the cartilage used to live.
But yes, total femoral and tibial cartilage replacement just didn't sound very good.
No, it's too long. It's
too long.
too long. It's too much.
Too much. Okay, so what's the main difference then, or why would someone get a partial knee replacement as opposed to a total knee
Right, so
replacement?
90% of the time if someone says, oh, I got a partial knee replacement, they mean they got the inside, the medial compartment replaced.
Right.
A unicondylar knee replacement, a uni. So there's a school of thought that believes that if only that compartment in the knee is diseased, has the bad arthritis, just replace that part. Don't replace the lateral side if you don't have to. Don't throw out the baby with the bathwater.
Which is such a weird phrase.
Did
Why?
anyone ever do that?
What, throw their baby out?
With the bathwater?
I bet they did. Obviously, it's probably happened back in the day.
And the silver lining was they came up with a phrase that lasted for,
Someone was like, Paul, where's the baby?
I don't know, I just threw out the bathwater.
That would be bad.
It's not even funny.
Don't start.
Okay. So you've got a,
Reel it in.
all right, so you got a partially replaced. So the medial side usually is what's replaced.
Yes. We're close here. We're close.
Okay.
Medial compartments replaced. So these are the people that are bow-legged. So it's someone that's bow-legged and the outer compartment looks pristine,
Yeah.
and the patellofemoral compartment is pristine. So you say, let's just replace one part.
Okay.
So that seems sensible.
Yeah, and the advocates of that would say you have a quicker recovery.
Yep.
You get out of hospital faster.
Yep.
You have a better range of motion.
Right. And theoretically down the road for revisions, you would have better bone stock to help with your revision.
That's true. It's not too difficult to revise compared to a total knee replacement.
Okay.
Those who do not go to that school of thought,
Yes.
they would say that no, a partial knee replacement doesn't really get you out of the hospital faster because we get people out of the hospital very fast now.
Agreed.
They would say the revision rate is higher. So those people have a higher chance of having to go back to the OR to have it revised to a total knee replacement,
Right.
Compared to the total knee replacement.
Not
group.
necessarily right away, but ever
No.
for sure.
Yeah.
Yes.
Yes. And they would say that the outcomes aren't quite as good. People still have some pain, some discomfort.
Right.
So those are the two schools of thought for partial versus total knee replacement.
Right, and the reason that people think that a total is necessary is because some people say, well, listen, you already got disease in one compartment. That disease is often not just isolated to that compartment. So when you go in there, you're like, you know what, there's some early disease on the outside, or your kneecap's got some early disease, or your trochlea, the end of the thigh bone where the groove is, that's got some disease. And we know that that's going to continue to progress. So maybe we should just get it done once.
Right. And so advocates of the total knee replacement instead of the partial knee replacement also say that the total knee replacement is less technically demanding than the partial knee replacement to do.
Which I think I would agree with.
And that's probably because the Total knee replacement, the instrumentation has advanced more,
Yes.
and it's more commonly done.
Yep.
So the advocates of the partial knee replacement say, no, you just haven't done enough of them. You have to do at least about 20 a year
Yep.
before it becomes easy for you, and your outcomes will be better.
Right.
So patellofemoral compartment.
Yeah, so that's also another unicompartmental or partial knee replacement, and this certainly has like a niche interest.
Yes. Outcomes as of yet are nowhere near as good as partial knee replacement or total knee replacement.
Right.
But it is done, partial knee replacement, and there's some renewed interest in that with the advent of robotics to do that, because that has made it a little bit easier to replace that.
And also because it's a really difficult population. It's often younger people
Yes.
that do have this isolated kind of kneecap disease, and they're
Yeah.
very debilitated. And when you're looking at someone that's in their, say, 40, you're like, geez, we're going to replace their whole knee just because they have bad kneecap. It's tricky.
Yeah, and we probably have a lot of viewers out there who have isolated patellofemoral arthritis,
Yes.
and as you well know, there's no good cure for that.
Right. So
Wow.
like, what's the take-home message? So yes, it's an option.
Yes, it's an option. I think the take-home message would be have a discussion with your surgeon
Right.
about the options.
Right.
And if your surgeon is an advocate of total knee replacement and does not believe in partial knee replacements, you want to know why they feel that way, and it's
Sure.
probably some of the things we just discussed.
Yes.
And they might say, in my hands, a total knee replacement does much better than a partial knee replacement. And if you feel comfortable with that, go ahead. If you really want to know, well, wait a minute, what about the partial knee replacements? Then you'd want to go see a surgeon who does partial knee replacements and total knee replacements, and ask them, why do you think I need a partial knee replacement?
But important to recognize that a lot of people are just simply, regardless of whose hands it's in, are just not a candidate for a partial knee replacement because of their dual or tricompartmental disease.
That's right. You may not be a candidate for
Even if someone who loves
Yeah.
partial knee replacement might say,
Yeah.
oh, I'd love to do an knee, but I can't because you
Yeah.
got too much disease elsewhere.
So if you think you understand this, I'm going to confuse you some more, because if you are in a population that could get a partial knee replacement, you could have a high tibial osteotomy. You'll have
Right.
to watch one of our other videos to see what that's about.
Yes.
There's no time to go into that now, but that's another option for that. So then other people say, well, we'll do the partial knee replacements for people who are 65 years or older.
Right.
That's often a cutoff that you hear
Got it.
for the partial knee replacement.
It's interesting.
It's complicated.
And it's not an exact science, right? It's a little bit of an art. There's no
Yeah.
specific one answer or
Yeah.
strategy that can be applied to everybody. So yeah, worth a discussion. Now you're kind of empowered to know the difference. And
Yeah. And if you're confused about it, that's okay, because the whole orthopedic community is confused about when to use a partial knee replacement and when to use a total knee replacement.
yeah, if it was obvious or universal, there would be a very specific algorithm, and
Yeah.
there's not. Okay. If you like this video, please like it, subscribe to our channel, and go to Movember website and support Talking with Docs if you think it's worthwhile.
I'm taking this off real soon. And remember, you are in charge of your own health.
Stay classy, San Diego.
That's a good one.